Hi, I want to show you a little bit of the anatomy of the vagus nerve and then of the psoas muscle, the big portion of the iliopsoas muscle. So the vagus nerve comes off the brain stem, way up high here. The base of the skull comes down through. The brain stem is portion of the upper portion of the spine, of the spinal cord, excuse me. So the transitional zone between the spinal cord and the brain. So way up here, the vagal nerve comes off, passes along the neck in this region, supplies, sends branches that help out with functioning in our eyes, nose, mouth, throat, continues down along the spine to supply our heart, our lungs, give information to and receive information from our diaphragm, and then all of the digestive organs receive information from the vagus nerve all the way down into the pelvic bowl area. And most importantly, the majority of the activity of the vagus nerve is information going from these organs up to our brain. Now, the second piece of anatomy I want to share with you is the location of the psoas muscle, which is a big part of the iliopsoas muscle. The iliacus part of the iliopsoas lies on the inside of the ilium, and the psoas portion is this big muscle that runs approximately along the line that my fist and arm are showing you. So from the 12th vertebra, the 12th thoracic vertebra, the last one of the last of the mid-back or thoracic vertebra, the ones that have ribs attached to them. The 12th one, the last floating rib, your ribs sit in about this area. The psoas muscle is attaching to this 12th thoracic vertebra and then the next 4 vertebrae of your lumbar spine. So it has slips or attachments going to the 12th thoracic, 1st lumbar, 2nd, 3rd, 4th lumbar, and then this huge muscle coming down through here, passing through the belly area, the abdominal area, joining with the iliacus portion, and coming down to attach onto this bump on the femur, which is called the lesser trochanter. This is the greater trochanter, this is the lesser trochanter. And what it does, it can bring the hip, the thigh forward, the femur forward. It's critical, it's essential for a smooth swing of the leg. And it can also, if the legs are fixed, the pelvis is held still, it'll pull the spine forward and bring the trunk forward on the pelvis. But it's, the other thing is there are nerves that pass through this big muscle. So you want a psoas muscle that is contracting when you want it to contract, relaxing when you want it to relax, and not staying in a constant state of contraction where it gets tight and short and hard and squeezes on those nerves and squeezes on the blood vessels and doesn't function as well as it could and should to give us a freely swinging leg and to keep our gut organs happy that have to share the neighborhood with that iliopsoas. All right, so that's a little anatomy. Vagus nerve, big, important nerve, taking information down from the brain, but most importantly, taking information up. And that psoas muscle, which is important for functioning of the spine and the swing of the leg, as well as being a good neighbor to the organs in our abdomen. All right?